The CDC says it is on the ground in Texas responding to the growing measles outbreak there. Health officials reporting nearly 160 cases of the highly contagious measles virus since late January. Karen Hua has more from health experts worried about the spread.
Officials in Harris County, Texas are announcing updated vaccination locations, encouraging people to line up for protection from measles as cases rise in the state.
Right now is not the time for anybody to get overly excited. It is not the time for anybody to get scared. It is the time to get smart, consider your situation, and if you need to get vaccinated, get vaccinated.
Measles is one of the most contagious infectious diseases.
Really, your best protection against measles is to be vaccinated.
One dose of the MMR vaccine is 93% effective. 2 doses, 97%. In the South Plains region of Texas, the measles have sickened nearly 160 people, most unvaccinated. A school-age child that was not vaccinated died last week.
There's this misconception that measles is the common cold. It's just a fever and runny nose. It can actually be much more severe than that. It can cause severe lung infections, severe brain infections.
With measles so contagious, the Texas Department of State Health Services expects additional cases in outbreak areas and nearby communities. Dr. Celine Gounder says some older adults should take notice.
If you were born after 1957 and got vaccinated before 1968, you may not have immunity from exposure to measles infection and may have received an older version of the vaccine that was not as effective. You are in a group that may want to get a booster, particularly if you are in an area that is experiencing an active measles outbreak.
And if you're not sure if you're immune to measles, try to track down your records. If you can't find them, Dr. Gounder says there's no harm in getting an extra dose of the measles vaccine to protect yourself. Karen Hua, CBS News, Houston.
And the child who died last week from measles is the first death here in the U.S. from measles in a decade.